Hello, my name is Dr. Nick Spencer and I'm AGFA's Chief Clinical Information Officer in Northern Europe. I'm delighted to say that I'm with Dr. Dan Fascia, who is a Consultant Musculoskeletal Radiologist at Harrogate District Foundation NHS Trust, and he's also the clinical lead for the Yorkshire Imaging Collaborative. Hello Dan, it's great to be with you today to talk about your experience of using enterprise imaging and mainly your experience as a radiologist. I'd like to begin by asking you what drew you to radiology as a medical specialty in the first place?
I guess it began pretty early for me. So as far back as being a second year medical student, I found myself doing special study modules. And then I really departed from it and went through surgical training. I was following an orthopedic route and went fairly far with that, up to kind of reg level. And I just found that my love of technology, programming and all things health tech was really starting to come to the forefront and picking up, and radiology was the perfect place to that. So I actually swapped training and moved over to radiology reg training.
And within radiology, what drew you to musculoskeletal imaging as your specialty and why?
As far back as the beginning of med school, I've always been into musculoskeletal sports medicine, and I think that's a theme I'll always continue in the clinical part of my career. I think it just drew me to what I perceived to be the part of medicine which was the best placed and best evolved for somebody with health tech interests.
Tell me about your day-to-day interests as a musculoskeletal radiologist and how enterprise imaging helps you keeping yourself in flow.
Yeah, so enterprise imaging is my kind of daily workhorse. It's where I do all of my image review, meetings, planning intervention, reporting all of the work I do. And of course, it's the place that I spend the most time when I'm doing the diagnostic element of my job, which for me is about 50% of my job. So it has to be somewhere which is an efficient and comfortable working environment, which kind of gets out of the way and lets you be productive in the actual job.
That's really interesting. What are your favourite features or functions in enterprise imaging?
I think that the viewer side of it is fantastic. So everything on the kind of viewing screens I find really very good and almost hard to improve on. You know, we're at the point of subtle improvements there with the feedback that we give you, you know, it's fast. It has all the tools built in. I don't find the need for advanced viewers and 3D packages, that kind of thing. So I'm very happy with that side of it.
And are there any tools that help you particularly with efficiency, with collaboration, or even with quality assurance?
I think personally, being a tech mind, I place a big emphasis on shortcuts and being able to automate repetitive tasks. So having good quality text macros and ones with variables in that you can, they don't look like macros, you know, they're not just copy paste, they actually have variable fields where you can change things each time and tailor the report. The other thing that I value a lot is having shortcut keys for everything. There is a great kind of programmable screen of shortcut keys, and I find myself using those a great deal to navigate around the application so I can keep my hands on the mouse to do the actual interpretation.
How does working with enterprise imaging and the Zero Universal Viewer in particular help your clinical colleagues in caring for their patients and ensuring that they deliver the best quality?
So one of the things that I do quite like is the fairly seamless interface between enterprise imaging and Zero. They are very clearly sort of from the same product suite. And so I like to create PDF-based reports where I'll create a lot of annotations, you know, draw the clinician's attention to things that I've found or observed while I'm reporting, and create those kind of rich reports in Zero. And in my hospital, that's how we consume the reports. So it gives a really good text plus visual way to deliver the imaging report.
That's really interesting, Dan. Thank you.
Yeah, we're working in an environment where the PDF reports are embedded in the hospital's EMR, and there's like a toggle switch so that the clinicians can then look at the images in full 3D form if that's how they are, alongside the PDF report. And I think that that's a big enhancement on how they were viewing things before, as very poorly formatted, just HL7 text blocks.
Just turning away from radiology specifically, I'm very aware of the work that the Yorkshire Imaging Collaborative has done over the last almost decade now as a groundbreaking collaborative network within the UK's National Health Service. Can you tell me about any of the particular things that have been great successes that have helped to deliver better care?
It's true that we're one of the very early imaging networks, so we did have a bit of a lead advantage there. I think that some things that I think find as key success drivers were setting up a good governance structure early on, so that we had a board of voting member trusts, each with a sort of responsible attendee, and that just accelerates decision making. Very recently we proceeded with a big NHS England AI tender, and as you'll know, the turnaround times for these bids are often very short, and just to have something like a board in place to turn that around fast can be the difference between winning it or missing out on it. I think it also sets the tone for collaboration. So if you have buy-in from senior executives, then there is a trickle-down effect that all the other staff buy into the collaborative nature of the network, knowing that their voice is heard.
And lastly, what would you advise if others were working on cross-boundary imaging networks? What are the things that they need to focus on to make sure of success?
I think that you do have to check that the fit is right for an imaging network, and you need sufficient population for it to be worthwhile, and also a geography where you have multiple institutions who perhaps struggle individually to get workforce and radiologists, but pulled together can create a bigger organisation that can work in a cloud environment to deliver a full range of subspecialism and just coverage of their work.
Thank you very much for your time today, Dan. I really appreciate, and I'm sure the audience will have enjoyed the reflections that you've shared with us. And I urge our audience to go to AGFA's website to find out more about keeping life in flow. Thank you.
Thank you.